Good afternoon, everyone, and welcome to this concurrent session entitled Supporting Parents and Caregivers in Nurturing Young Children in Pandemic Context. We have a set of good speakers from the countries and also from the University of Wollongong, who has helped us document cases of ECD practices in the context of pandemic. But please allow me first to walk you through the objectives of this session. First, we would like to highlight the critical roles of parents and caregivers in nurturing young children in pandemic context, and then present to you some of the innovations introduced in specific ECD programs in the Philippines, Vietnam, and India, particularly how these have been adapted to respond to the challenges of COVID-19. And third is to draw insights from the documentation of the good practices in the Asia-Pacific region in the context of COVID-19. So for our first presenter, if I may just introduce to you, Marc is the Professor of Child Development and Academic Director at Early Start University of Wollongong, where he leads interdisciplinary early childhood initiatives involving the university and community with the goal of improving developmental, educational, and social opportunities for young children. Marc's own research focuses on how children become socially and emotionally competent, with a particular interest in children's understanding of thoughts and feelings in others and themselves. With his colleagues at Early Start, Marc works to translate current evidence on child development and early learning into the everyday care of children and professional practices. He also currently serves as the NSW representative on the board of the Australian Children's Education and Care Quality Authority. Ladies and gentlemen, I'd like to present to you Marc de Rosnay from the University of Wollongong Early Start, Australia. Marc, over to you.
Welcome, everyone. It's a great pleasure to be here. I'd like to thank Evelyn for the introduction, thank ARNEC for organising this wonderful event and all their partners. And I'd like to acknowledge the other speakers who are coming after me. It's been a great honour to be able to do a piece of work for ARNEC and its partners to derive insights and lessons from an analysis of work that had been occurring with great vigor and passion in many countries. And we were really pleased to be able to learn about these different initiatives, to learn about the innovations and the committed people who were driving that work, and to try and capture some of that, some of the best practice and some of the innovation for sharing, for documentation, and also to try and gather up a broader view of what we can learn from this incredibly difficult time, so that we can better support children and families going forward, and we can improve our preparedness. With that, I will just make sure this works. So we, as I said, we were commissioned to develop knowledge products based on the internal resources of ARNEC and their partners that would initially derive from a webinar series in 2020 and 2021. And also the resources of partner organisations, other agencies and governments. The resources related to programs in different countries that were a response to the pandemic. And we were trying to capture good practice and innovation. And we were trying to link that practice and innovation in particular to the nurturing care framework developed by the WHO and its partners, and also to a lesser extent to the Sustainable Development Goals, but of course they are nicely coordinated between themselves. So what this work represents is, I need to stress that this wasn't an evaluation. This was a real-world response to complex and challenging circumstances that arose because of COVID-19, and we were there to capture what had been done, to try and put that in a form that it could be communicated broadly across the region in a format that was common and that could be used to capture the programs, the innovations, the leadership, the funding, etc. All those things that the information we could access in a way that was accessible broadly and quickly to others. This resulted in 10 case studies, which I won't name. I'll show a slide in a second that shows all 10, but I won't go through and read every single one. But I would encourage you to contact ARNEC if you want to get a copy of those, and I'm sure they will publish them in good time. And an integration report, which then looked across the whole region, across in case studies, and tried to form some high-level generalizations. So these were the 10 case studies, and you can see there was a broad representation of countries and the broad representation of kinds of organization. And that's important because there were development organizations, there were organizations that were extensions or sort of leading authorities endorsed by government, and then there were more sort of ground up kind of organizations. So there are diversity of organizations, and I think that's important. And you can see that the majority of the case studies focused very much on supporting children and their families. Like I said, ARNEC can provide these case studies to those who are interested. So we tried to adopt a formal methodology to maintain rigor and to bring a very careful analytic eye to each of these case studies. Like I said, without actually performing an evaluation, we weren't saying, were these good or bad? Were they successful or unsuccessful? That wasn't our role, and it was beyond our scope. What we were saying is what happened, who was affected, how was it done, and can we capture that in some way? What was learned was also a very important aspect of that. So the formal questions were, how did ARNEC, its partners and other organisations, including government bodies, respond at local, regional and national levels to meet early childhood development needs? How can we distill these initiatives, including the approach, the experience and the innovation, to inform future responses and adaptations in the context of what we've called increasing social and environmental volatility? How can we document the implementation and impact of separate initiatives in ways that illustrate their potential usefulness for practitioners in other contexts? And are there clear policy messages that can be distilled so that the relevance of the work can be incorporated and adapted within different jurisdictions? And I think that's particularly important to realise that we tried to write at a level that was relevant to many jurisdictions, so not sufficiently detailed that it was about implementation in a specific jurisdiction, but tried to present those ideas, considerations in a way that they would be accessible to a broad audience, but nonetheless highly relevant to each country's context. We had an information gathering phase where we consulted with ARNEC, identified the case studies and sought information from the partner organisations and other participants. We use a structured interview methodology where we had standard questions but also bespoke questions based on the materials that we had been provided through the documentation analysis. We did a mapping of the findings to the nurturing care framework, which I'll talk about in a second, which was quite a useful exercise, and I would encourage jurisdictions to think about that because it's such a open and comprehensive consensus model for the needs, understanding the needs of children, the nurturing care needs of children. And we identified future implementation considerations, evidence-based policy considerations. And then finally, we had ARNEC and an advisory group, which we're very grateful to, check through some of the materials and make sure that they were happy with the way there was uniformity, that we hadn't strayed from the path, as it were. This is a diagram that just captures our methodology. Very quickly, there's the seminal information requests. We had multiple interviews potentially, depending on what that led to. So the interview and follow-up information requests depended on what we learned from those interviews. We sought to establish links with existing evidence bases so that in each case study, you can see we've tried to link the practices in those specific jurisdictions or contexts to the existing evidence base. And we had, like I said, quite a systematic methodology, which I don't have time to do full justice to today, but would be happy to provide a copy of the integration report to anyone who requests it, and that provides an account of that methodology. As I said, we tried to map the different initiatives and programs to the Nurturing Care Framework. We see the Nurturing Care Framework as a set of guiding principles that provides a thoughtful and thorough starting point for organising the approach that we took. We found both the level of outcomes to be extremely useful and the level of strategic actions in thinking about what were the impacts for children and how were jurisdictions able to use their resources and their human capital strategically, and how might they be able to do that in the future. We found the discipline of thinking about the outcomes for children under the 5 headings provided by the Nurturing Care Framework as a very good discipline. I think it's too easy just to make broad statements about the well-being of children. And there are many situations where, for example, we might be able to, in the medium term, meet some of the health and nutrition needs of children, but their opportunities for early learning might be very severely impacted. And so unless we make a distinction between those outcomes for children, we tend not to measure them separately, and we can lose sight of very important aspects of children, of the nurturing care of children, because we're focused on where we're having impacts. So I just recommend that, and again, we've given an account of that in the integration report. So what themes did we identify? Looking across the 7 countries and the 10 case studies, we found that the use of technology to support connections and information sharing, including information sharing directly with families, was of absolutely critical importance. Even in cases where families had very limited access to digital technology, there were cases where a single mother became the conduit for information in a group of mothers through one device. We found that every level of service provision, the importance, obviously, of good internet technology and information dissemination. And we found, furthermore, that these channels became very fruitful when relationships already existed. So for a community worker who already had a relationship with their community or a group of families or a particular mother, it was easy, relatively easy, as long as the technology was in place, to then use that technology to maintain the relationship. We didn't see good examples in the case studies that we examined of people forging new networks through digital technology in the COVID-19 pandemic in community. Mostly it was the use of technology to forge, to consolidate where other initiatives had already begun or were established. There was the importance of remote engagement and a motivation to reach and support families. A number of the case studies showed us that there are very viable models for engaging in quite rich ways with families at a distance, remotely, and that families assume, as long as there's trust and relationships in place, that families are willing to engage in those initiatives. We found a prioritization of the home learning environment to support children's daily learning at home. We all know, of course, that the home learning environment is the first environment of learning and well-being for children. We supplement that in many jurisdictions, in nearly all jurisdictions, with early learning. But of course, early learning is not a substitute for the home. And when early learning in the community and face-to-face provision can't occur, then we need to depend on the home. And so we need ways of building programs and delivering programs which support the home environment, that are user-centered, accessible, and attractive to parents, and are realistic as well. Leveraging of pre-existing programs and workforce to ensure high-quality practice and outcomes. What we found was where there was a good network in place and good community understanding in place, that could be leveraged to do a number of things in the case of COVID, including information dissemination, delivery of programs, but also the delivery of programs in cognate areas. So people who were in contact with communities for education reasons could also then be used to deliver health information, for example. We found that the empowerment of community leaders to create leadership and ownership was quite a prominent feature of many programs. We found that inbuilt flexibility and responsiveness of programs and the ability to listen to participants and assess environments as they're changing was a very important feature of responding well. We found that partnerships to create uniform approaches and learning opportunities between organisations were very powerful. So that is where there was already in place understanding between government and a development agency or other organisations about the common approach, that worked quite well, although there were relatively few examples of that. And we found that there was a need for measurement and tracking systems to support familial input and show effectiveness of programs. We gave quite detailed policy considerations, which I won't go into in detail, just to show you the headings here, and point you again to the integration report if you would like to pursue that. And they're quite coherent with the themes that I just read to you. I would like to just take a moment to reflect here on the sort of approach that we adopted. We sort of put forward policy considerations stressing positive actions that can be taken by jurisdictions to ensure that there is preparedness and understanding of the challenges presented to children's learning, development and well-being in conditions such as those presented by COVID. And we would extend that to a range of other possible scenarios, including foreseeable scenarios to do with climate change and environmental degradation, where such insights might also be very valuable. In framing these considerations, it was our intention to show how existing policies, systems, workforce and collateral and strategic thinking need to be in place prior to circumstances. What we found is that the most effective and best practice that we observed always leveraged a system that already existed. And I would wrap up with this note. It's a bit of a long quote, I'm sorry, but let me read it to you because I think it's an incredibly important thing to get right. Whilst the needs of children and families are similar the world over, the specific circumstances of children and families mean that most programs will only be effective if they account for the individual contexts of people's lives and reflect their specific needs and preferences. In bringing together the case studies, there were numerous illustrations of how this contextual responsiveness, is what we called it, was achieved within a diversity of contexts in which families are living. A strong emergent theme within the case studies was that the importance of existing relationships between, for example, ECCD professionals and communities or families was essential. When relationships already existed, there was a foundation for changing the program delivery and responding to community needs. Another theme to emerge was the need for monitoring systems within programs to ensure that they can adapt to circumstances change. Finally, it's important to emphasize that to a lesser or greater extent, programs appeared to succeed when they adopted user-centered design principles, such as using authentic community consultation, which embodies the experiences and circumstances of the users as they are, and doesn't try to make the user conform to the program constraints. So thank you very much, and I look very much to hearing from the presenters coming up. I feel, as I said, honored to have worked on their work. But of course, they were the ones delivering the programs, and I think they'll have some very valuable insights for us. Thank you so much.
It was very insightful and very relevant because it reflects the context that we are facing. And I especially liked the part where you emphasized on having strong relationships with the community. So that becomes a very important aspect. So thank you again for the presentation. Now, I would like to invite Dr. Inciong for her presentation. She is the Executive Director of ECCD Council of the Philippines. She has over 40 years of experience as a leading educator in the Philippines, and her leadership has yielded the establishment of national child development centers in more than 730 cities and municipalities of the Philippines, which are using the model of convergence for health, nutrition, psychosocial, and early learning services for the 0 to 4-year-old children. So over to you, Dr. Inciong.
Okay. Good afternoon, everybody, ladies and gentlemen. My session today is about the Early Childhood Care and Development Council home-based program in the Philippines, which is supportive of the parent and caregiving during this pandemic. The COVID-19 pandemic revealed the vulnerability of the implementation of ECCD center-based program when centers or schools were closed for an indefinite period. So the The home-based program became the most effective mode of service delivery for the learning continuity of children while supporting parents and other caregivers during the time of pandemic. This program has a legal basis in our Republic Act 1014, the earlier years Act of 2013. The ECCD system provide programs to promote optimum growth and development of the children. This includes center-based program and established in every barangay, which is village to you, providing programs for children and home-based programs such as the neighborhood play and other modalities. This is also the foundation of the ECCD home-based program, designed to address the inaccessibility of center-based program. By establishing and implementing the ECCD home-based program, the ECCD Council promotes and reinforces the role of parents and other caregiver as the primary child caregiver and first teachers. Our goal, aside from expanding access, is to address the holistic needs of these children aged 0 to 4, especially during the pandemic. Now, our target areas are where the children and their families that have no access or having difficulty accessing center-based programs, such as areas that is no established center, especially in geographically isolated and disadvantaged areas. Some have also limited to public transportation or traveling may be unsafe. They may also be occurrence of disaster or emergencies or presence of armed conflict that limit access to the center. Moreover, it targets a specific population, such as those children with disability, at risk and vulnerable, and belonging to indigenous people. We engage heavily the local government. The ECCD Council advocates the home-based ECCD program as a complementary to center-based program. This is promoted to the local government units through the commitment and leadership of the local chief executives to replicate and implement the program in their area. The Council supports the LGUs by providing stakeholder guides and establishing the program and capacitating them to contextualize principles of child development in the practical home application. The LGU's investment and support are very crucial in sustaining the efficient and quality program of implementation. This is the framework and the slides. You have the first one is the supervisor. Their task is expected The framework summarizes the stakeholders, their task and expected outcomes of the home-based program. The main service provider in the home-based program model are the supervisors, which are the MS and child welfare development officers. The facilitators are actually child development teachers and workers, and the parents while the child is the direct beneficiary to achieve the holistic development. The supervisor supports implementation by providing resources as a representative of the local government to sustain the program. This includes capacity for building of facilitators and provision of learning aids and other resource materials. The facilitator trains the parents on the developmentally appropriate practices and responsive caregiving to equip them with basic child development principles. They provide guidance on how they can improve the implementation of activities and respond to their children through the weekly parent session. They also give regular feedback to their supervisor in the program implementation and evaluation. The parents, on the other hand, implement developmentally appropriate activities and respond appropriately to their child needs. Since they are the implementers of the program, they are the ones who have direct interaction with their own children in play and home-based activities. They provide regular feedback of their activity experiences to the facilitator during the weekly sessions. We have 4 phases of this ECCD home-based program. These phases defines the roles and responsibility of the facilitators and parents, and how this progress towards parental independence. It should be noted that these phases take into consideration the parents' skills and abilities rather than fixed timelines. So it's highly individualized in terms of implementation. These allow the facilitators to properly go through the phases and the parents to adjust to the role as the first teachers. As such, it is highly individualized, as I said earlier. Phase 1 supports parents on the training of the home-based program, including the roles and responsibility, assessment using the ECCD checklist so that they will be able to track the performance of their children, whether they're on track, delayed, or advanced, designing weekly plans, and teaching strategies and activities. The facilitators are the primary developers of the weekly plan, which may contain 2 to 3 activities or according to the ability of the child from the National Early Learning Curriculum to be implemented at home by parents. The planned activities aim to address the child's needs based on the assessment results. The facilitator orients the parents on their activities during the weekly session, where parents are tasked to implement these and observe their children's performance to the activities as means of development of succeeding plans. Phase 2 increases the involvement of parents who are tasked to introduce and implement the modification in materials, instruction, or even the schedule of written or weekly plan. The third phase is building up the parents' ownership of the program. By this time, they are able to make their own weekly plan, and as they began planning and implementing the activities for their own children. Facilitator continued to guide them to ensure the development of appropriateness of the activities. Phase 4 establishes the parental independence and task parents as the primary developer of this weekly plan. In short, they are now having more confidence in coming up with a weekly plan, while the facilitator continues to serve as guide, but entirely support the sustainability of the program by empowering them to continue planning the knowledge and continue and improving their knowledge and practice provided to them. There are many challenges during this time. 1, some parents may not be able to, are not highly educated. 2, they do not have enough time. 3, every family have encountered some challenges throughout the program. However, some of the parents are really trying very hard at involving the family. Next. Okay. With the implementation of the home-based program, there was an increase in parent participation and family involvement in the child's life experiences. Parents and family members felt closer together and shared their learning experiences with their child are valuable, and with the child experience it which are valuable and meaningful to them. Capacity for ECCD service providers improve as they receive technical assistance on home-based training. Finally, the home-based program is being offered and accessed by the families in investment of the LGUs for quality programs and improve and services are promoted and sustained. There are some of the video clips that the children are doing at home-based activities. Maraming salamat po. Thank you very much.
Thank you, Dr. Inciong. It was very enlightening, and some of the points, especially related to involving local government units for home-based programs are, all the ECD professionals in the region will learn from the successful model of ECCD Council at Philippines. And I also like the 4 phases of parental engagement because it's building a progressive, effort at engaging the parents. So thank you so much for this insightful presentation. Now we move to Tim Huang. He is the Chief Impact Officer at OneSky for All Children, blended learning for home-based childcare providers, which is delivering responsive caregiving in Vietnam. And Tim has worked as a researcher strategist and a trainer for the Bhutan Youth Development Fund, Royal Government of Bhutan, UNDP, UNICEF, and the United Nations Global Study on Children Deprived of Liberty. And he is also recognized as a Dalai Lama Fellow. So we are very happy to have you, Ting. Over to you.
Thank you, Nalima, and thank you to ARNEC for organizing these important case studies in this session. So what I'll be sharing with you today is on OneSky's home-based childcare training program in Vietnam and how we adapted the program for improved digital delivery during COVID-19 to support caregivers and children. I'm not sure if you're able to see my screen, but just started screen sharing here. Let me try this one more time. All right. Fantastic. So what I'll be sharing with you today is a little bit on our home-based childcare training program in Vietnam, and then how we, again, adapted this program for digital delivery during COVID-19 to support caregivers and children. And so first, a little context to our work. What we've seen in Vietnam over the last decade is decreasing agricultural productivity in rural areas due to climate change and growing economic opportunities in urban areas. This has led to millions of migrant workers moving to cities and industrial zones for work. And the majority of these low-wage migrant workers in factories are women with children. And they enroll their children in the growing home-based childcare industry because of its affordability and accessibility. These childcare providers are local entrepreneurial women who open their homes to offer childcare services while parents work in factories. And there are over 17,000 of them in Vietnam. But these home-based childcare centers are of variable quality due to limited training, resources, recognition, and support. And in these low resource settings, children are often not receiving the early stimulation and responsive care they need to thrive. You might typically see 24 children sitting in front of a television with one caregiver who's trying her best, but just doesn't have any support. And this was all before COVID-19, which really exacerbated inequities and challenges for low-income families and households in Vietnam. And home-based childcare centers, which were critical supports for these families, were temporarily closed and then reopened during recurring lockdowns, and were really essential to supporting families, parents, as they got back to work. But now we're seeing, with 90% of Vietnam's population vaccinated, the country has really focused on reopening its economy fully. And we know that home-based childcare is critical to COVID-19 recovery, to early childhood development, to supporting families and gender equity. And in 2018, we launched a blended training program for these home-based childcare providers to improve the quality of early childhood care and education through responsive caregiving for vulnerable young children living in these industrial zones. And over the last 4 years, including during the COVID-19 pandemic, we've reached 960 providers and over 26,000 children in their care. So this was our model pre-COVID, which was a blended approach that includes 20 classroom sessions in person every 2 weeks, led by a OneSky trainer, in-person home visits for coaching by trainers, and all of this being scaffolded and supported by OneSky's One Big Family online learning platform. And during COVID, we adapted the in-person components of the classroom training and home visits for coaching onto Zoom for complete digital delivery. To do this, we really focused on professional development to improve OneSky trainer proficiency in online teaching, coaching, support, and content development. We also really tried to minimize screen fatigue through brainstorming breaks, role plays, guided discussions, and other interactive activities and supports, including on OneSky's One Big Family platform. And all of our training and programming, whether in person, prior to COVID-19 or fully digital during COVID-19, are supported by One Big Family, this One Big Family online learning platform for providers in Vietnam. And this is accessible via iOS and Android mobile apps on phones and tablets, as well as through a user-friendly online version for all devices. And on One Big Family, Providers will find training lessons and discussion forums to really reinforce and extend that classroom training. These lessons and content are also connected directly to each training session, so providers can really discuss and access more support from their trainers and peers on each topic. There's also a vibrant digital community of practice in which these providers have agency and voice to really share their own best practices, videos, photos, ideas, resources, and questions with their peers. We also have a monthly recognition session to really celebrate and encourage provider engagement. There's also a section on the platform for providers to engage in on-demand Q&A with early childhood experts and specialists, both local and global. And it's really buttressed by a rich digital content library with play activities on expressing feelings, counting family members, searching for colors, moving to music, which providers can both use themselves as well as share with parents of the children in their care. Local songs and stories that are culturally rooted and responsive to Vietnam, a plethora of professional development articles, do-it-yourself, low-cost toy making at home using recycled or local materials, including downloadable guides, an animated responsive care video series and topical teaching videos by our trainers, and a Be Creative online competitions section that really empowers providers to create and share their own innovations, content, and resources on the platform. These include, learning environment design, homemade toys, and storytelling for children, just as a few examples. And the platform has also incorporated regular vetted COVID prevention and response resources for child and family health. And unsurprisingly, we also saw providers sharing their own best practices and guidelines on safely reopening their home-based childcare centers after recurring lockdowns and reopenings. Overall, we've seen high utilization of our platform, over 78,000 total logins among 960 providers on the platform. Average logins increased by 15% during COVID-19. 80% of those logins are on mobile phones. 33,000 plus comments and over 1,400 unique pieces of digital content that were uploaded by both trainers and the providers themselves. In the interest of time, I'm only going to read through the second quote from Miss Mien, a provider, a caregiver we trained during COVID-19. And she says, "OneSky helps us connect with the wider community of caregivers across the country. I know who to turn to whenever I have a question, a problem, or a concern. Being a part of that supportive community means we're not alone in getting through the pandemic." And so the qualitative feedback we've received from providers themselves on our blended and digital program model has really fallen into two buckets. One on continued learning and professional development, and the second on the power of belonging and community. And our program impact has been validated by an independent evaluation conducted before and during COVID-19 by Harvard University and RTCCD, a leading local research NGO in Vietnam, finding high provider satisfaction, sustained improvements in home-based childcare quality, improved child development outcomes, and provider motivation, information sharing, and belonging maintained during COVID-19 through digital support and One Big Family. And just going forward, really continuing to focus on improving the platform through upgrading the interface, the features, the content, offering post-training support and networks, digitizing the monitoring to support that program implementation, and working on a new strategic partnership with Vietnam's Ministry of Education and Training to scale this model up. Here's just some of the global recognition of our training program and model. And lastly, just to sum up, some of the key lessons we've learned really focus on, number one, building digital communities of practice, two, meeting caregivers where they are, both in terms of technology and content that meets them at their digital literacy and educational level. Three, really centering human connection and belonging through community building. Four, activating caregiver voice and agency and really co-creating the digital learning experience. Five, creating those program feedback loops that Marc talked about. And six, the importance of really investing in home-based childcare, which is such a critical service and care infrastructure for working families during COVID-19, and all of the support programs that go into training and upskilling and supporting home-based childcare providers like our program. And so with that, thank you so much.
For that interesting presentation, and it's wonderful to see that how technology is being used to provide home-based ECCD programs and interventions. And I really like the Be Creative and the health resources features on the app. Also, very interested in the capacity building. During this whole time of the pandemic, we have realized that upskilling and building our capacities is an important thing. So when you talked about building the capacities of the ECD professionals, that was really interesting. So thank you for the presentation. Now we'll take a short. We have two more presenters or speakers who will be talking about their work. But before we move to the next speakers, I would just like to ask a few questions, discuss a few points with the speakers who have presented till now. So the question is to Marc now. Marc, based on the findings of your, the presentation that you made and the findings that you made from the study, what can we draw from the cases of Philippines and Bhutan, and especially with respect to the contextualization and scale? Because Tim also talked about scaling, the importance of scaling, and this is one aspect where most of the programs need more guidance. So what is the opportunity for contextualization and scaling in the Asia Pacific region? Marc.
Well, I think there's probably a very good story here to tell. Obviously, in the last two presentations, I think we see two very different approaches, but with some very common concerns and approaches at their core. And they both seem to be enjoying a great deal of success. I think that one of the things that emerges overwhelmingly is you need, if I could be so cliched, you need an authorizing environment. And I think the ECCD Council of the Philippines is a beautiful example of an authorizing environment. You also need innovation, and you need direct, to work directly with workforce. And both of these examples that we've just seen give different but similar approach to capacity building, continuing education with an adult learning focused lens, and the incorporation of a digital element. And I think those kinds of insights, those kinds of examples are very much the way forward. So having that rich authorizing environment, an environment where there is the capacity to have a chain of authority to enact changes, but then bringing that kind of beautiful thinking around the user that we saw, in particular the OneSky, I think is such a beautiful example of how to think about the needs of a real group of people on the ground already in place whose needs have not been met as professionals. So these kinds of approaches, as exemplified in these case studies, are just beautiful illustrations to me. I hope that gets at the question.
Yes, absolutely. Thank you, Marc, for that response. So my next question is to Dr. Inciong. Now, taking us back to the time of the pandemic, a lot of information was not available regarding young children and the parents or caregivers at that time. Now, based on your home-based ECCD program in the Philippines, how did you adjust, and how did you navigate when this kind of information was not available? If you could throw some light on that.
Actually, when on March 16, to be honest, to be exact, on March 16, 2020, all the schools and the centers were locked down. But there is this, the smallest unit of governance in the Philippines, which is the barangay or the villages, and they have a captain or the head. And so the center, together with the social welfare development officers and then the barangay council, meet for some time to be able to plan how to engage the parents to come to the center, and then given the orientation, well, of course, observing the health protocol as mandated by the Department of Health. So they made this program. They made a weekly plan. Well, the first is they orient the parents. Some of the parents do not have transportation, but the barangay, the local council, brought them to the center, and then they orient them there. And after that, they are able to emerge into the program, and they have prepared as I have stated. So, if the parents cannot come to the center, the teacher who prepares the weekly plan, either they brought them to the home of the children, or through telephone, or through some of them are capable also of using the online. So that is what they're doing. I think what is very important here is the collaboration and cooperation of the local government to the community. That is where the investment is placed.
Thank you, Dr. Inciong. I think very well said that the collaboration with the local government units is the key here. Thank you for that response. And before I take my next question to Tim, I would encourage all our participants who have joined us online to type in their questions if they have any questions for the speakers, Marc, Dr. Inciong, and Tim. Please do type it in the chat box and we will take up your questions. So Tim, you explained, you helped us understand the situation and the scenario in Vietnam. As in many developing countries, I'm sure in Vietnam also, the challenge is that baseline information related to young children and caregivers is limited. So did this impact your intervention and your project in Vietnam? And what lessons can we draw from the experiences of Vietnam, which can also help the other interventions and programs that are running across the region? Tim.
Thank you, Nilima. So I think on that first part of that question around baseline information and really having a sense of the early childhood kind of ecosystem and where young children are in the midst of the pandemic. A lot of that came from our direct interactions with providers as well as the authorizing environment. So partnering with provincial governments, really understanding the needs of the home-based childcare providers themselves. And so our program model has really focused on doing some of that surveying ourselves through home-based childcare providers and the children in their care, and our understanding of how caregivers are delivering on responsive caregiving practices in that home-based childcare context, and then how that translates ultimately into child development outcomes for those children. And so a part of the learning in the context of Vietnam has been not so much redesigning our model, but adapting it from what we know has already worked pre-COVID. And so we had already a blended model that then we said, okay, we're going to take into a completely digital context. And we found through surveys with the providers that keeping in touch, staying connected during COVID, as well as learning through technology was really fundamental to making sure that all of that baseline information on what we know about children and families, there's going to be some sort of support and follow through in making sure that you can deliver on quality responsive care during COVID-19. And so I think just in summary, again, just kind of leveraging that authorizing environment, understanding the workforce piece, really focusing on ways that you can meet caregivers where they are with that blended and digital learning have been some of the key takeaways from us.
Thank you, Tim. I'm sure these takeaways, these learnings will also help the other ECD professionals and programs across the region, the participants who are tuned into the conference. So thank you for this response. I don't see any questions in the chat box. So let's move to our second set of speakers, shall we? So I would like to now introduce and continue with the second part of the session and introduce Samyukta Subramanian. She is Program Lead Early Years at Pratham Education Foundation. And Samyukta Pratham actually is one of the largest nonprofits focused on improving quality of education in the Indian context. And Samyukta leads the ECE and Early Grades Initiative across many Indian states. She has extensive experience of working with government officials, private sector partners, nonprofit leaders, and has developed and implemented various educational initiatives. So we welcome you, Samyukta, and over to you for your presentation.
Thank you. Thank you, Nilima, and ARNEC for giving me this opportunity. I'm very happy to be here and pleasure to share our experiences and learnings with the early years during COVID. I'll be sharing a presentation and based on that, I'll be sharing some of our experiences. So as Nilima mentioned, we at Pratham work on improving the quality of education for children in different age segments, both in India and in different parts of the world. For the presentation today, I'll be focusing on what we did with young children, especially preschool children in India, and what were some of the experiences and challenges. So at Pratham, we work with preschool centers. Often they are called Anganwadis or community-based centers. And these are in the department of, the WCD department, which means the Women and Child Welfare Department. There are also preschools within government schools. And we work with, in some states, we work with children within those preschools. In our direct work, we reach out to approximately 90,000 children across the country. We engage with their parents or caregivers, in particular mothers, often because children spend maximum time with their mothers at this age, and we spread across different states of India. In partnership with the government, we work at the district level or the state level, and there we have formal government partnerships within the institution and outside. And our big focus here is on improving the way in which content is created and delivered in class and as well as with communities. So if I quickly go to what is it that we were doing pre-COVID and what were the things that were different, then pre-COVID, whether it was a government partnership or our own work, we would support the teacher in conducting activities in class with children and also engaging with parents. We would also have volunteers. Often you have adolescent girls who visit these preschool centers for their own nutrition and health awareness needs. And we would volunteer, we would mobilize them to also help with the work in class, especially in education. And we would create mothers groups in the community. So a group of 3 to 4 mothers whose children are going to these preschool centers and one person as the anchor mother, and having a small discussion around teaching learning almost every week. Print material would reach them, and that's how we would move forward. When COVID happened, and of course it took all of us by surprise, we needed to quickly pivot, and we had always done face-to-face work, and so this was a challenge for us, which we quickly, I think we were able to rise to it very quickly. Also realizing that the first thing that the country needed, and our communities who we were already in touch with, what they needed was more information around COVID and what are the kind of safety and health precautions that they needed to take. We also needed to be aware of the communities where Pratham works, which are all largely underserved communities. And so a typical video, let's say, for example, which has running water, which teaches you how to wash your hands, may not work in our communities where water comes at certain time intervals and one has to reach out into a bucket to actually access that water. So the videos needed to be contextualized, but awareness and health was the first priority. We wanted mothers and children to play together, even though we were not in the area because of the sort of lockdowns. And we started doing lots of phone calls back and forth. So we were in touch with the community. We began sending out messages over any platform that we could, but we also tried to keep in touch with the mothers and their children to ensure that learning doesn't stop. So in a nutshell, we call this campaign Thodi Masti, Thodi Padhai, which means a little bit of fun and a little bit of learning. We try to reach out to communities, that is parents, volunteers and children, to facilitate learning within their homes, support through all kinds of media, whether it was audio calls, IVR with some governments, WhatsApp, SMS. We also tried to curate all the content that we had, which means that we had open source content, which Pratham had been creating independently, not realizing that it would be so very useful in these times. And so we were able to use all the content that we had in different languages to send it out over the phone. And we also collaborated with different organizations. There were many organizations that reached out to us in these times, who said that, you know, we've been working with adults, but what do we do with the children now that they are at home? Parents are struggling. Their interface was with the parents, and where we supported them was with the sort of engagement that was possible at home between parents and children, and of course the content. The one thing that stood out for us, which we thought was extremely important, was the continuous communication. And you know, the content going out was one part of it, but we had to put together very quickly a system whereby you had the guidelines for WhatsApp, but we also realized that there are SMSs, which means simple keypad phones, which are often not the smartphones. We had to create messages to fit into about 150 characters so that it would go into that phone. And we had to translate that because we worked in different states of India where they speak different languages. There was a Pratham EC person on the ground who couldn't really enter the village because of the lockdown, but would send out the message and also follow up, which means asking the mother, calling the mother and saying, did you receive the message? Often she wouldn't know that it's come into her phone. In a simple phone, it's even tougher to understand, because if the box gets full, then you don't get to know there's a new message waiting. And then following up later in the day or the next day to say, how was the activity? What did you do? What kind of resources did you use? And so on. And often parents would take this up and then they would send videos and wherever possible and messages about what they were able to do. And I'll share that with you soon. So for example, if we see this WhatsApp message, this is about explaining how plants grow. And there's a message that goes out. And in response, especially for those with smartphones, people would send back what they were able to do with their children in response to this message. So this is, and these are the responses which helped us realize that we are actually being able to reach out to the community, and the activities that we are sending out are actually working for the parents. In the case of a simple keypad phone where you really couldn't send back a message, many would go to their neighbor's home and pick up the smartphone to tell us, to be able to share with us photographs of how their children were doing it. The messages would be something around the developmental domains. So for example, if you have a bag and you have different things inside it, close your eyes, touch it, tell me what it is, tell me something about it. A lot of engagement required between the parent and the child. As part of our government partnerships, we also tried to share whatever we had in whatever form the government felt they needed to reach out to children. So, for example, in a state like Himachal Pradesh, we were able to share our content with the teacher, the government school teacher, who would then send ahead the content to the children in her class. So it wasn't Pratham with the direct interface, it was a government teacher. In a place like Delhi, they would have a missed call system, which means a child or the parent would call a number and get to know what's the activity of the day for the preschool child. On television, in Bihar, for instance, there was a time slot, and we would create the content that we would create would be shown on a regular basis at a certain time throughout the state. And then there were many content repositories, digital repositories that states had created and that were created at the national level, where everything that we had could be uploaded in the relevant language. In Delhi, Himachal, Punjab, WhatsApp and SMSs continued, and in fact, we continue with many of these initiatives even today. And in places where we could not reach out, either through smartphones or through keypad phones, we tried the radio to reach out to parents and their children, both in Maharashtra and in Uttar Pradesh. We would try to do this. Uttar Pradesh would play the radio episode about half an hour every day for 6 days of the week, excluding Sunday. So what were our learnings? I think there were many, and we were thrown into this, and we went with our instinct. And I think, as Marc said earlier, it was the existing connections with the communities that really helped us leverage all the different innovations that we were able to come up with during COVID. And so we realized that while there are there is content that needs to go out on a certain platform, there's also social structure around it, which means what is that social fabric? What are those things in the communities that need to be leveraged for content to not just go out, but to also be effectively transacted? So while we talk about digital infrastructure on the one hand, we realize that social infrastructure is equally important. The other thing we realized is when we would take feedback, it was the first time we were doing this, so we needed a feedback loop around the activities, content that we were sending out. And so we realized that the ones that were most popular were those that were fun, easy to understand, things that mothers and children both enjoyed doing, and things that had, where material was very easily accessible and one did not have to struggle for it. Most importantly, an activity that continued throughout was the follow-up calls. So to be able to be in touch with the parent, with the child, with the parent expecting a call sometime soon, for us to clear their doubts, that human connect that we were able to establish, even though we couldn't physically be there, we realized was one of the most important part of all of this being effective during COVID. So there were many more learnings, and I could talk more about that, but these are just some pictures from homes in different parts of the country, where mothers, children, siblings were all trying out everything that we would send out over the phone. We continue to think that we should we should not stop creating or sharing the kind of content we have been sharing over digital platforms, only for the reason that while face-to-face can continue, it's almost like this sort of content would provide that support, that air cover, if you will, in case there is a disruption tomorrow, in case there's a lockdown tomorrow. We feel like something like this should continue while our face-to-face work has already opened up. So I'll stop there and back to you, Nilima.
Thank you, Samyukta, for that wonderful, explaining the context from an Indian point of view and how we reached out to communities, to underprivileged and marginalized children in our Indian context. Thank you, Samyukta. So time for the next speaker. Our next speaker is Ramjan Ali, and he's an ECD manager, Plan International Bangladesh, and he works on the gender-transformative ECCD projects in Bangladesh. And Ali is an educational professional with over 8.5 years direct experience in development and humanitarian setting. And he has great interest and expertise in ECD, primary education, education in emergency, and educational research. And we are very happy to have Ramjan here to present his context and the interventions and the learnings from those programs and approaches that they adopted in Bangladesh.
Thank you, Nilima, for introducing me, and thank you, ARNEC, for the opportunity. It's a great opportunity for us to share our project interventions, how we are bringing the positive change to our beneficiaries. Plan International Bangladesh is driving to. Can you hear me? Strive for the advanced children rights, especially for the equality for the girls. So our programs like this, my project is implementing in the for the gender transformative early childhood developments to make these ECD interventions gender transformatives. We conducted like this the gender assessment and identify the gender norms in the working areas, first of all. And I have a presentation, I would like to share it, how we alternatively implemented, supported the children in their holistic developments during COVID-19. I'm sharing my presentation. Please allow sometime, please.
After the presentations are over. Yeah, over to you, Ramjan.
Can you see now? Yeah. So we started this project in the middle of the 2019, and after starting the project, we like this COVID-19 started, and all of our learning ECD centers closed by the government. It's not only for our centers, it's closed. All learning center education institutes are closed by the governments in the March of 2020. So, and countrywide lockdown started, and there had very limited access to support services. And during for that time, we sit together in a team, our national office colleagues as well as our implementing partner, CCMO workshop, SAP Bangladesh and Shurubi. They are implementing this project as a technical partner as well as the implementing partner. So we sat together and try to find some alternative ways to continue our support to the children. So I would like now I will share what we did to continue our support during the COVID-19. And for what we did, our learning centers were where around 20 to 22 learners get access in one learning center. So as the center were closed, we established Khela Ghor. It's like a play space for all learners' house. So that they can learn even though the learning center were closed. So to make the Khela Ghor play space more effective, we the facilitators train the parents, caregivers, especially the fathers, to how they can collect, develop low-cost free materials, play materials, learning materials for the children, and continue their development process. They can support their development process. To make the parents and caregiver trained or facilitating, we had a one-to-one session twice in a week, and our facilitators visited their house and stayed with the children as well as their parents or caregivers. Sometimes his children's siblings also stayed together, and facilitators trained the caregivers how they will do, what they will do in the next 14 days, what types of rants, what types of play, games they will play, what story they will share. These things facilitator trains and demonstrates to the caregivers. So that's continue, as well as we also provide a text message to the parents through mobile phone. On these messages are mainly for the parenting issues, like this, what they will do with the kids during the COVID. These things messages contain on the messages. And we also develop some audiovisual documents, materials for the children, for the parents, as well as we provided some audiovisual materials like this, the tab, multimedia projector for center-wise, not individually. So we shared the audiovisual documents to the facilitators, and they shared in small groups to the parents and caregivers to disseminate the messages very consequently. And we formed Father Cafe, and we formed grandparents group as well youth club. So this group mainly support us to support gender-transformative ECD during the COVID. So, and our this audiovisual document mainly focus on the gender-based discrimination issues, or focus childcare, child protection issues are mainly focused in the audiovisual document. And we shared these documents through multimedia projector to the Father Cafe, small parents group, and youth club. So Father Cafe is a group of fathers whose children are going to our learning center. So in the Father Cafe, they learn different child parenting issues from the facilitators, and they are practicing with the children for their children's holistic development. As well as we also develop some interactive learning and play materials that helps us a lot. These materials illustrated picture books, what types of activities they will do with the kids. So that's the all types of parents, like this is illiterates can, all types of parents can read, and this is a self-guided book materials, and they can read as well as to practice with the children. We also had some social media content promotion, and we had some live sessions on different child protection, child parenting issues, so that they can continue support their children during COVID. As well as we also distributed numbers of conducted numbers of COVID safety security awareness sessions, so that they can be safe and they can be safe and secure. That's the our ECD intervention mainly focus on the 0 to 8 years. So as ECD centers had accessibility for the 3 to 5 year children. For the rest of the children, 6 to 8 year children, they go to the government primary school. And we also had some remedial in educational support for the 5 and 5 above children, so so that they can they recover the learning loss during the COVID-19. Especially for the children who don't have any family member who can support in his education. So like this, our youth club members, I shared with you that we form youth club. So our youth club members are mainly responsible to conduct the remedial sessions for the children 6 to 8 years. So that's the way we try to cover the learning gaps within our working areas. For the male engagement, for the GET ECD during COVID-19, our facilitator visited to the learner house and conducted gender responsive childcare and development issues with the facilitators, especially for the father, and they sensitize, and as a result, they collected huge numbers of colorful, low-cost, unused materials, and they are using these materials in their children's developments. Our facilitator try to make them understandable that, for example, the caps of the drinking water or the drinking waters, they can use for teaching the colors, as well as they can teach the shapes also. So that way we try to sensitize the parents to support their children. As well as we develop some video documents, and we share these video documents in the Father Cafe as well as the grandparents group. So that way we share the masses and continue the supports during COVID for the children's holistic development. And the lesson learned from these alternative models is that parents are now more aware, and they are more positive toward child rearing and caring. They are more attached to their children, and in earlier times, rarely they spend times with their kids. Mainly mothers that gives times to the early children. So parents becomes more attached with their children, and education department officials appreciated our initiatives, and sometimes they ask to other agencies to do same, because in our model, children are in the house. As they are getting their lots of learning materials, their parents are spending quality time with them, so they are staying a house, and it helps to control the COVID transmission. And local government as well as local officials, especially males, become more promising to support the early child developments, and they can see the changes of the children. So that's all. Over.
Thank you, Ramjun, for that interesting perspective from Bangladesh. And I really like the concept of Khelo Ghar, the Father's Cafe. It's in the Indian context also, we've seen that when fathers are involved, the child outcomes are much better, and there is a more enhanced, and comprehensive coverage of ECCD interventions. Yeah, so taking a few questions if there are in the chat box. First, I think first question to Samyukta. Samyukta, tell us a little more about how you introduce the playful parenting, and the early stimulation interventions in urban and rural environments in India. Were there any specific things that you kept in mind? And are there any practical insights that you can share with our participants and audience?
Sure. So Nilima, we had, we knew we were working with different communities, both urban, rural, but also in different parts of India. So the one thing that we knew that we needed to keep in mind was a language. So we had different languages, the content or the activities and the person interacting with the community would be familiar in that language, and the content would go out in that language that can be understood. However, we cannot assume that everyone parents receiving these messages on their phones means that they can actually read and understand what is coming in, because the literacy rates may vary. In the same home, the mother may not be able to read. And if they do read, this is unfamiliar content. And so they may need some support to comprehend or understand what is it that the message requires you to do. And so we would keep these aspects in mind. And so those follow-up calls would, of course, become very important. The other thing we would keep in mind is the kind of local resources or materials that are available in and around you. So, for example, some things that are available, let's say in urban areas or in the north of India, may not be available in the south. It may not be part of your eating pattern. So, for example, peas are often had in the north, and we ask you to peel it. We ask the mother and child to peel some green peas. But in the south, we may ask them to substitute that with another vegetable or another item that could actually lend itself to peeling. The other thing which we found interesting was that while the messages were the same, we found that in rural and urban areas, there's a difference in the sort of technology that is available in the house. So in urban areas, the smartphones are there, and in rural areas also. But the ownership of the phone with the mother in rural areas would be less, in the sense that she would have to wait for the, let's say if there's a person who's working in the house, unless they are also at home, she would have to wait for that person to come back so that she could then take that message and then do the activity with the child. Whereas in urban areas, if the smartphone one was not available, an additional smartphone to access the message would be often easier. And so what that meant was that our follow-up in rural areas had to be much more, and we also had to vary the time. Like what time would be, mothers had still not, let's say mothers would only be able to do the activity in the evening. And so we would have to follow up much later or next day early morning. So these are the kinds of nuanced understanding that I think we gradually built over time and then adapted to it.
Yeah, thank you, Samyukta, for that, because, as we move forward, we face different challenges, and how we navigate through these challenges are very important. The learnings are very important, and they can be used by our participants and audience across the region. Thank you so much for that. Now, my question is for Ramjan now, which is that as in other cases, we are seeing in Philippines, we're also seeing in Vietnam, Plan Bangladesh also explored remote learning. And this remote learning was used to reach out to parents and caregivers during the pandemic. Now, was there a distinctive approach that Plan followed in promoting responsive caregiving, especially with respect to the father's engagement in the ECCD program?
Okay, thank you. In Bangladesh context, as a Muslim is around more than 80% people are Muslims, and in culture, mothers are mainly tasked with the early age children. Father are rarely interfered or joined in the children's activities. So, in considering that, Plan International think that we need to engage the parents, as we, if we would like to make changes in terms of gender transformative, like this, if we would like to change the gender norms to make the just equal world for the all. So we need to work in the beginning. So we engage the parents in the father cafe. It's like a small group, spend their relaxed times and discuss how they can engage with the children's development, and how can every toys like this, every toys have some anyone can use different way like this. Sometimes in the mind that dolls and cooking sets are only for the girls. So it's not like that. This can be cooking can do boys also. So this type of normal gender norms we need to change. So that's things we are trying to work in the beginning of the children's development, so that they can be respectful to others, job as well as the other identities. So that's we considered. And to make it effective, we developed like this. So we didn't stop our work. Even though it was COVID, we developed some video audio materials so that we can share these messages to the remotely. And as this is a video document, so that's the self-explanatory. They can see what and they can learn the messages, as well as our facilitators are visiting learners' house, and they have also had interaction with the parents and the children. So both way we work, as well as in some project, another project, we made some picture illustrated book for the different activities. For example, what type of activities they will do. You know, there's the many literacy rate is very low in Bangladesh in terms of around many people are illiterate. So we developed some illustrated books, self-guided. The drawing how kinds of activities they can do, jumping for the children's physical development. There's things they can do, and through the illustrated book. So that's why we tried to continue our support. I think that's we can do other areas also, and we also sent some text message to the parents, so that they can also learn and be aware and how they can support their children. Over.
Yeah. Thank you, Ramjan, for that. So we have time for taking a few more questions. So I would like to ask Tim. There is a question for you. What would be the preconditions and prerequisites to utilize your program for ECD caregivers and teachers? And is this model applicable in other countries? And do you have any plans to expand your project area? Tim.
Great, thank you for the question. I think about the preconditions in a couple of ways. One being the community assessments and consultations to really understand the need among the home-based childcare ecosystem in any context you're working in. Second, really the enabling environment, authorizing environment, government partnerships that would actually support a training model for home-based childcare providers. And third, in terms of digital and blended components of our training model with the One Big Family platform, really the need for robust existing digital infrastructure and digital literacy among those caregivers. So in the case of Vietnam, we already saw wide smartphone and internet coverage. And so that was a very easy kind of build on to our program. That said, we're working on a national scale up in Vietnam, and we're very open to further expansion. We see our model as very applicable to other countries across Southeast Asia, As I mentioned before, climate change and poverty have really been driving rapid rural-urban migration, and we're seeing a growing need for quality, affordable childcare among migrant working families. And so it's really a critical moment for these types of investments in home-based childcare as a way to support families, caregivers, and children.
Thank you, Tim, for that response. Now, I would like to ask one question. This is for Marc. There's in the audience here from Shiv Nadar Foundation in India. A participant wants to know if, and especially keeping the Indian context in mind, we have a lot of diversity. So the question is, do institutional arrangements, are these institutional arrangements detrimental in certain ways for contextualizing ECCD interventions across different regions within the country itself? Marc.
Obviously, I don't feel comfortable making a generalization about India. We only looked at certain case studies, and my knowledge is quite limited, and it's an incredibly diverse country. Maybe some reflections that might be helpful are about, generally speaking, institutional, how can we put it, institutional approaches are always approaches that risk, or institutional arrangements always risk not being contextually sensitive. Okay, so I think that's something that I've already highlighted the importance of, and I think other speakers have as well. One of the barriers that we encountered quite often, which perhaps is not where the asker of this question imagines it was going, but I think it's an interesting point to reflect on, is parents often, we encountered a number of places where parents were resistant to home-based early childhood education because they perceived, their perception of the institutions was that their children needed a formal education setting. And I think that's a familiar problem in a new guise. So that's the familiar problem of parents not properly and fully understanding the value of their own interactions and rich interactions within their homes and their communities for early learning, and a belief that education in the early years only occurs in a formal setting. So our institutions, I think, need to, in order to optimize outcomes for children and families, there's a very difficult public messaging or marketing piece that needs to be continually revisited and remembered, which is that if we don't embolden and support parents, we're actually undermining the key environment where children learn and flourish. I don't know if that's helpful, and I don't know if that gets to the key question, but as I said, I don't feel qualified to comment on broadly on the Indian context.
Thank you, Marc. I think that helps explain, how we can contextualize how we can draw a balance between contextualizing and as well as institutionalizing the ECCD programs. So, thank you, Marc, for that. Now, I would just like to take because we are almost at the end of the session, and just go around the table and seek your inputs on what was the greatest challenge that you encountered in ensuring learning continuity amidst the pandemic in your context, and drawing from that, because we are very interested in the understanding recommendations for the policymakers. So if we can, we'll just go around. I'll take the names of the speakers. You can talk about what kind of challenges that you encountered in ensuring learning continuity amidst the pandemic? And if you were to make a pitch to the policymakers, what would be that? So I would like to start with Dr. Inciong. Dr. Inciong.
Okay, thank you for that, Nalima. And I'd like to thank also Mr. Marc for including us in their case study, and ARNEC, of course, for initiating that. But I will remove my mask. In this, for policymakers, actually, the home-based program in the Philippines is already embedded in the law, the Republic Act 1014, which is the Early Years Act. However, what we're moving forward and we're pushing is for the investment of the local government, and also their local ordinances, like ordinances for that. That's one. And number two, we would like to advocate for ECCD home-based program through more legislative agenda from the place where geographically isolated disadvantaged area, because that is where we're supposed to be seeking their collaboration and cooperation. It's very difficult right now to actually engage those very early from infant and toddler. That's where we are targeting, because if you remember the early this morning, the session of Dr. Carnes, it says that, and we are all aware of that from 0 to 5, that is the fastest brain development, and so we have to catch that up. So that's for the policymaker, more investment, more legislative agenda, and more cooperation and collaboration from the national to the local government.
Thank you, Dr. Inciong. That is very valuable in the sense that it's not only applicable for the Philippines context, but it applies to different contexts. Thank you. Ramjan, would you like to take this question? What is your recommendation for the policymakers?
Thank you. In Bangladesh, like this, the parenting session, the parenting intervention are not in the national initiatives fully. So different non-government organizations, NGOs are working to provide parenting session. So I will seek attentions to the policymakers to give concentration on parenting. So how we can make it institutionalized, because like this, for the schools, preschools, schools, they are only engage the children in the teaching, learning, or play things materials initiatives, but rarely with parents we have parenting session, parenting interventions from the government side. So I think that is the area where governments can work more, and organizations can support to make it institutionalized. So parents will be more aware to support their children for the first 8 years, as 80% of the human's brain develops within the first 8 years. So, and around 1,000 neurons are connecting in every second. So that is very important, crucial time. So we need to work together.
Thank you, Ramjan, for that. Samyukta, would you like to answer that question? The recommendations for policymakers.
Okay, so I think my recommendation would be that we've learned a lot during the pandemic, and we may have a need to go back to how things were before COVID, which is back into the classroom. So my recommendation would be, don't lose this opportunity and the learnings from COVID. It is only together with the parents and communities and teachers, of course, that we can support the young child. And having learned so much about how to work with communities and parents, my recommendation would be that we continue to do that and not go back to pre-COVID times and only in classroom initiatives.
Thank you so much. Tim, would you like to answer this question?
Yes, thank you. So many great thoughts that have already been shared. And I think just to complement that from our work and thinking about some of the structural barriers that home-based childcare providers face during the pandemic on the economic front. I mean, many of them having, limited free time for continued learning and professional development because some of them had to work other jobs just to keep their businesses open so that they could provide childcare services. So I think about, the investments that are needed to support not just the childcare providers, but the families in terms of cash transfers, in terms of loans, in terms of other types of supports that make it possible for these types of programs to best support responsive caregiving in the home environment. The other thing I'll just mention is, what Marc was saying about generating parental demand for home-based early childhood care and education, really understanding that that's a key piece of creating a closer partnership between, professionals like childcare providers and parents in supporting their children. And that's a piece that we also are continuing to think about how we can build in and strengthen in our programming. And then just the last thing about exactly what Samyukta was saying about the plug and play of knowing what we've learned coming out of the pandemic in terms of digital, but also recognizing the value of that in-person piece in terms of community, in terms of connection, but not losing some of the incredible benefits. And so, to the extent that we know the effectiveness of some of these methodologies, where does blended, where does digital, and where does in-person all come into play in supporting caregivers and the children? And so I would just say those kind of three pieces around investments, closer partnerships between parents and providers, and then knowing kind of how to plug and play between the digital, blended, and in-person.
Thank you, Tim. I think I would like to thank the speakers for doing my job. I was supposed to conclude and, bring summary points, but all the speakers have presented so beautifully the main points that are coming across. So giving the last and the final pitch to Marc about the session that we've had. Moving forward, how do we use these learnings for the reopening, as we are saying, children are coming back to schools, they're going to the ECCD centers. We have learned so much in these past 2.5 years. So how do we take it forward? Marc, over to you.
Well, let me start by saying that I'm just finishing a policy paper for ARNEC, and that hopefully will capture some of these messages. And I hope that's available very shortly. Some of the right messages I think have already been provided. Investment, workforce. I think, and again, this point has already been made, so I want to acknowledge that, but not losing the insights and the learnings that have come from COVID. In fact, we think that the learnings and insights that have come from COVID are applicable to many foreseeable and sadly inevitable situations. We think that every jurisdiction probably needs, alongside its frameworks for early childhood practice and curriculum, developed through any or delivered through any kind of centre-based care, it also probably needs, and I'm arguing this case in Australia as well for your information, we need frameworks for what we're calling over-the-fence delivery, but because we have so many services, but we might think of it as the home-based curriculum and models, because it's clear that even when we're not in a pandemic, there are many groups within communities, in every community that we've looked at, including our own, where attending a face-to-face early childhood service is not a realistic undertaking, and even if it is, it's only in the year before school. So the early childhood learning frameworks and practice frameworks that we have should be multifaceted. They should accept that early childhood interfaces with, early childhood education, if I'm bringing an Australian lens, has to interface with health and child protection. And that has to be a part of the thinking around building our frameworks of practice, and an understanding that the home environment is the main environment of learning, development, and well-being. And any way that we can improve connections with families and communities, grow relationships, sustain those relationships, support caregivers, which are typically mothers, but not always, is incredibly valuable. These things can't happen, though, as they can't happen with any consistency if there isn't the right authorizing environment, and that should be led by our politicians. There should be legislation, and there should be regulatory frameworks that provide a guidance all the way down to local authorities to enact the kind of structures that we already know support children. There are no secrets in the nurturing care framework. There are no secrets in the Australian early childhood learning framework. We know what kind of interactions support children. We know that they need, experiences drive development, and those experiences accrue over time and they matter. So all of those messages can be packaged up, I think, in ways that are accessible to policymakers. You might have, although maybe not, noticed in Australia, we've just had an additional and quite large investment in early childhood in the New South Wales context. And it's pushing in this same direction towards greater integration between health, child protection, and early childhood provision, and more accessibility for parents. These messages and these funding initiatives are incredibly valuable in every jurisdiction. Like I said, if we have frameworks for distance delivery and for supporting home-based early learning, then when we're in a muddle because of COVID or floods or whatever it is, we will already have practice frameworks that we can leverage rather than trying to invent solutions under duress, which is always a much more compromised and difficult thing to do. I just take a last second selfishly to celebrate the different case studies and groups that we've had the privilege of analysing and collecting information on. It's been a wonderful experience, and I hope that the case studies are widely circulated and that we can learn from each other. And so thank you to ARNEC and the partners for making that possible.
Thank you, Marc, for beautifully summarizing it. And we look forward to the policy paper that you mentioned. Very interested in reading it. I would also like to take this opportunity to thank all the speakers for their wonderful presentations and providing us a glimpse of how we are supporting parents and caregivers across the region for better child outcomes. I would also like to take this opportunity to thank ARNEC for providing this platform where we can discuss and learn from each other. And lastly, I would like to thank all the participants who have joined us across the region, across the globe. Thank you very much.